Hi guys, it's Dr. Adam here. If you're thinking about having a knee replacement, there are some really important questions you need to ask your surgeon before you go ahead. It's your knee, so don't feel shy about asking these, and most surgeons will be more than happy to answer. As a surgeon myself, if I was having a knee replacement, these are 5 things I would want to know. So the first thing I would want to know is how many knee replacements does the surgeon perform each year? As with most surgical procedures, there's a relationship between higher volume and better outcomes, and this systematic review found a significant association between low surgeon volume for total knee arthroplasty and higher rates of infection, procedure times, longer length of hospital stay, transfusion rates, and worse patient reported outcomes. Now, there's no exact cutoff for the number of procedures they need to be performing per year, but you want to make sure your surgeon isn't just doing a handful of knee replacements each year and that they're doing them regularly with an implant that they're familiar with. If your surgeon has just changed to a new type of implant, or just started, for example, robotic surgery, or changed their practice significantly in any other way, they're likely to be on a learning curve. So you want someone who's high volume, using a tried and tested technique that works for them. The next question is, which implant are they actually using? There are several well-tested implants on the market with a good track record, and your surgeon should be able to tell you which one they're planning to use in your knee. The ODEP, or Orthopaedic Data Evaluation Panel, is a UK-based website that's a really useful tool if you want to quickly check up on the performance of an implant. ODEP ratings provide a simple, independently verified assessment about implant performance, and they give you a benchmark against agreed standards related to the number of years of evidence that the implant has for its use and its associated revision rate. And if you're not sure, just ask your surgeon and they should be able to tell you about the performance of the implants that they'll use. Question 3. What is their complication rate? And by this, I don't mean generic figures for knee replacement at a national level, but the specific rate for them and also the hospital where they work, which is often just as, if not more important, because it affects lots of factors such as the quality of ward care, nursing and medical care, and post-operative care. Some specific things you might want to ask include the infection rate, rate of revision or redo surgery, and patient feedback, which your surgeon should be able to tell you. Question 4. Ask your surgeon directly if you are suitable for a partial knee replacement and whether or not they are able to do this. For many people, only half the knee is worn out, as you can see in the X-ray here, where the red arrow points to the worn part of the knee and the green arrow to the relatively unaffected part. In this group of people, evidence suggests that partial knee replacement can offer benefits in terms of improved function, a lower risk of infection, and lower risk of medical complications. If you're not offered a partial knee replacement by your surgeon, there are 3 reasons why this may be the case. The first scenario is that you're not suitable for a partial knee replacement, and your surgeon can explain this, and it may be due to the pattern of arthritis or other medical conditions that you have. The second scenario is that after speaking to your surgeon, you've decided that you'd rather have a total knee replacement based on the pros and cons of each, which is also fine. The third scenario is that you are suitable, but your surgeon says that they just don't do partial knees, and this isn't acceptable. If you might be suitable for a partial knee replacement, you should be offered the chance to speak to a surgeon who does them and can go through the potential benefits and drawbacks so that you can at least have that conversation. Finally, you need to ask what the arrangements are for follow-up. How will your surgeon close the skin? Who takes out the staples or sutures? Is this your surgeon, your family doctor, or a nurse on the ward? If you have a problem after the operation, who do you contact? In some cases, you might be told to go to the emergency department. Sometimes there is a dedicated number on the ward, or even a rapid access surgical clinic, but it's really important that you find out these questions before the surgery. I hope you found that helpful. Please remember to like and hit subscribe for more videos coming up soon.